Hello, I'm Dr. Sal Masi at Natural Care Chiropractic in Huntington, New York. I wanted to take a couple minutes to let you know what I think chiropractic care is and how I administer chiropractic care to my patients. Chiropractic care is a form of manual medicine. Maybe medicine isn't the right word for it, but it falls into a category of medicine that's done with your hands. Hand techniques that relieve muscle stress, muscle pain, restore motion to the spine. So we use our hands to administer the care. Sometimes we use other tools. We may use massage stones, massage devices, a roller, ultrasound, electrical stimulation, different things that assist our hands in providing the relief and the restoration of function. So restoration of function means an individual loses movement, loses range of motion, has short, tight muscles, their ability to raise their arm, flex their spine forward begins to diminish. And when they do it, there's pain or discomfort. The chiropractor is the specialist in restoring movement, especially to the spine and the spinal segments. So a typical individual that comes for chiropractic care, usually it's an individual who's experiencing some sort of discomfort or pain. That's the typical presentation. Or an individual who has just noticed that their ability to look to the left or look to the right has diminished. The ability to bend forward and pick something up causes a little achiness or pain. These are typical presentations, but should not be the only presentation. Chiropractic care is for people who feel good and for people who are in distress or discomfort, because chiropractic care is one of the ways that you maintain and restore function of all the moving parts. The moving parts of the spine, the moving parts of your wrist, your elbow, your shoulder, all the joints, and all the muscles that control the joints. So how does chiropractic care at Natural Care Chiropractic differ from other types of care? Because those of you that are watching this who have been to chiropractors 1, 2, 3 have seen that each chiropractor is quite unique in their approach. And I'm not saying that one approach is better than another approach, although I feel the approach that I use is one of the better ones. Not because I am just, saying that to you to sound good, but because the patients who have experienced other types of care, who then use the natural care approach, do much better, have longer lasting results, and give me that type of feedback. Great success in cases where other types of care have not been as helpful. So it's not to compare what I do to others and to say that Natural Care Chiropractic is better than all other types of chiropractic care. Different types for different folks, different outcomes, different results. Mine is a very thorough approach to care. Right? It begins with a discussion, as we would say, history. Talking to the patient about what they're feeling, maybe why they're feeling it, what has happened to bring this on, if anything. Getting a past history. Have you had damage to your joint? Have you suffered with arthritis or other conditions? Possibly Lyme's disease, right? Very common one now, associated with joint ache. That could be a component. But you have to ask the question. You have to have this discussion. You have to talk to the patient, find out the most you can find out about the individual and their condition, to begin to formulate the proper diagnosis. The diagnosis is the key. Without a solid diagnosis or working diagnosis, you are operating blindly. So interview, discuss current history, past history, habits. How do you sleep? Do you sleep on your belly? If you sleep on your belly, probably good reason why your neck is always stiff, sore, painful. Maybe you're having headaches. Maybe it's because your neck is stiff, sore, painful. One thing leads into another. This is the beauty of diagnosis. This is the beauty of care. This is why being a chiropractor, being a doctor, is so wonderful. You get to work with lots of different people. You get to understand their unique circumstances and come up with a diagnosis that fits them, that works for them, and brings them great relief. The physical exam. After talking about it, it's time to do. Use these hands, these tools, to scan, to feel, to palpate that person's area of injury. Check the muscles. Check the tension on the muscles, the ligamentous tightness or laxity, meaning too much movement. How does the joint move? Does it move through its normal range, or is it restricted? Does it go the full 90 degrees, or does it stop halfway? Does that movement cause the pain that the patient is experiencing? The examination using palpation skills, using joint tension, joint stressing, joint provocative testing, using muscle stretching, checking the length of the muscles, using orthopedic tests, established tests that show, yes, this individual does lose pulse pressure when you turn the head and bend the arm back, indicating possibly a thoracic outlet syndrome. I'm using that as an example, meaning there are tests that exist that we can do that give us clues, that tell us, you know what, you need to look at the scalenes, you need to look at the pectoralis major and minor, you need to look at these areas because there's something causing dysfunction. The diagnosis, understanding the patient's condition, and being able to convey that information to the patient. So the patient now knows, you know, why you feel the way you feel. Can we always hit it on the head? Do we always have the exact diagnosis to explain why you feel the way you do? Not always. Sometimes we have to peel back, right? We say, okay, we see tightness in the trap, let's deal with that. It may not be causing your exact pain pattern, but let's deal with this layer of tightness. Remove the stress in the trapezius. Oh my God, look at this. The rhomboids are harboring trigger points. Let's work on that. Oh, you know, that's the one that's more like the pain I feel. So sometimes you have to work in layers, as we say, peeling the onion, where we start with the most obvious, and we peel that away, get to some deeper layers, and maybe eventually get to the root of the matter. Many times we can do that right in the first session. Sometimes it takes a little bit more development. Once we have come up with a good working diagnosis, and once the patient, you, understand what that diagnosis is and why you're feeling the way you're feeling, we can begin treatment. And treatment is a kind of bunch of different techniques strung together to give you optimal results. For me, it begins with loosening up of the muscles, using massage technique, cross-friction massage, trigger point therapies, effleurage, muscle stretching. Physically taking the muscle or the limb or the part of the body and stretching that muscle, creating new length using techniques like neuromuscular re-education, post-isometric relaxation stretching. Terms that simply mean that we use the nervous system and the muscle system together to give a long-lasting, more thorough stretch of the tissue. All of these techniques are comfortable to the patient tolerance. Yes, if you have a knot or a trigger point in your muscle, and I find that, and I want to go in, and I want to break that trigger point up, it can be uncomfortable. But we communicate. I say, can you tolerate this? Is this comfortable for you? Yes, that's okay. I feel a little discomfort. It is a little painful, but it's okay. You're in pain. We're trying to relieve pain. There is going to be some discomfort during the process. But communication, we're talking, we're working together. Then the manipulation, joint mobilization, joint manipulation, making sure that the joints that have lost their range of motion, that are restricted, can move again. Cervical spine, thoracic spine, lumbar spine, the spinal segments, the sacrum, the sacroiliac joint, common areas for chiropractic care. The spine is made up of individual vertebrae that are supposed to move independent of one another. Many times we find multiple vertebrae working or moving together as a group. We need to isolate and restore motion, because those vertebrae that have lost motion, and this applies to any joint, wrist joint, elbow joint, shoulder joint, if motion is lost, the ligaments, the tendons, the muscles that surround that joint become short, become tight, and continue to restrict movement. And then you try to move, but the movement is restricted, and the muscle is short and tight, and it hurts, and it feels tight, and it's uncomfortable. So you don't do it. It becomes tighter, it becomes shorter. You're not using it. You're favoring the other side over the other, and the muscle becomes weak. A weakened muscle fatigues faster. When it fatigues faster, it causes cramping, spasm, pain, and so on. It's a spiral. One thing leads to the next, and it's a downward spiral until we start to unravel the problem. And that's why you come for chiropractic care. That's why you come to someone who takes the time to understand your diagnosis, to present your diagnosis, to then explain the different types of treatments that will be used to help relieve your discomfort and restore normal function. That's why you come to Natural Care Chiropractic. That's why you come and see me. Because that's what we do. That's what I enjoy doing. That's what the patient wants you to do. And we administer the care. Gentle manipulation, gentle mobilization, gentle stretching, massage therapy techniques, perhaps heat, hot pack, ultrasound, a type of heat, maybe electric stim, but I tend to do more with my hands, less with the physiotherapies. I bring them in when necessary. And then the final component, the most important component, the most difficult component. What will you, the patient, be willing to do at home to help facilitate your healing, to help maintain the care and the treatment that we did here? Because ultimately, it's about you and what you are willing to do. Do you want to be a healthy individual? Do you want to feel good? Do you want to preserve this beautiful body that you have for as long as possible? Because that requires rest, hydration, good nutrition, regular moderate exercise and stretching, stress reduction. That's a hard one. Right? For some people, maybe spirituality. Are you willing to do these things at home so that you don't have to come and see me all the time? Some conditions require regular intervention, and you need to see me more often. Some, we can treat it, manage it, correct it, and with good, proper support at home, home care, you can maintain it. And see me less often. Once every 2 weeks, once a month, once every 2 months. Again, each individual is unique, each condition is unique, each person will have a slightly different outcome to care, will need slightly different types of home care protocols, will need different frequencies of care. That all depends on the individual. So I thank you for taking the time to listen to me today. If there is any questions, if there is anything I can do to help you, please feel free to contact me. I'm Dr. Sal Masi, Natural Care Chiropractic, Huntington, New York.